such as problems in impairment in communication, uh, or social participation, functioning at school or work, or personal independence at home or in the community. And the limitations, because of these limitations, it is necessary that ongoing support at school, work is, has to be there. And the onset should be during the developmental period, that is before the age of 18 years. And how do you assess intelligence? So clinicians and educators, we administer. When we give a diagnosis of intellectual developmental disorder, we assess the child or an adolescent on two areas. One is, as the criteria itself saying below average intelligence and below average adaptive behavior. So you have to assess on these two areas. So first is you assess the child, I mean, in terms of like you perform, you administer intelligence test to measure intellectual functioning, and we also administer adaptive. We have different different scales to measure adaptive behavior. Okay, so intellectual functioning, we have different intelligence tests, such as, Binay Kamath. That this is Binay Kamath is an Indian version of Binay Simon, and then we have Wechsler's intelligence scales, and different types of intelligence, to name a few, and adaptive behavior scales. Some of the examples which we have is, depending upon how you want to pronounce this, it's some people call it as Vineland, and some people call it as Vinayland. Vineland adaptive behavior scale, then we have AAMR adaptive behavior scales. So these scales are used to assess the child or a person, the adolescent, on adaptive behavior. Okay, so the child has to show, once you perform an assessment, there has to be below average intellectual functioning and below average adaptive behavior, adaptive behavior function. Okay. So, what are the features of intellectual developmental disorder? The most consistent sign of intellectual developmental disorder is that persons, with this disorder, they learn very slowly. So, and other areas of difficulty are in terms of, like, they face attention, short-term memory, planning, and language. And those who are institutionalized with intellectual developmental disorders are particularly likely to have these limitations. So, we traditionally, there are four levels of intellectual developmental disorders, that is mild, moderate, severe, and profound. So, mild level of intellectual developmental disorder. Here, the IQ range, the child with this mild level will have an IQ range between 50 to 70. Okay, so his IQ levels will fall around somewhere around 50 to 70. And moderate intellectual disorder, IQ would be in the range of 35 to 49. Severe intellectual developmental disorder, IQ range would be 20 to 34. And profound intellectual developmental disorder, here the IQ would be below 20. So, so what is like this mild, what are the features of mild intellectual developmental disorder? So as I just mentioned, approximate the maximum cases of intellectual developmental disorders, almost approximately 80 to 85% of all cases with intellectual developmental disorder will fall in this category, mild this mild category, that is with IQ range of 50 to 70. So, and sometimes, with proper training, a little bit of with proper training, their intellectual performance also seems to improve with age. And research has linked mild intellectual development disorder mainly to socio-cultural and psychological causes, particularly, see if children. So what they found that children with who have been provided with unstimulating environments, okay, not enough stimulation during the developmental period, so their IQ levels would be below average compared to other children who have had opportunities for exposure. And inadequate parent-child interaction has also been found to be responsible for this mild IDD. I'm going to use short form intellectual development disorder as IDD. Okay. And insufficient early experiences, not enough opportunity for early experiences, early learning experiences have also been found to contribute towards this mild IDD. And studies have linked mothers, they have also found that biological causes, that if during pregnancy mother had a substance abuse problem, such as like taking alcohol or drug use or malnutrition during pregnancy, can lead to cases of mild IDD. And for moderate, severe, and profound IDD, the features like approximately 10% of persons with intellectual development disorder will fall at a moderate IDD level, that is IQ between 35 to 49. And children who fall under this moderate level, they can be independent to some extent, such as like they can care for themselves, and they can benefit from vocational training and can work in unskilled or semi-skilled jobs. And approximately 3 to 4% of persons with intellectual developmental disorder will fall under severe IDD. Okay, that is IQ range of 20 to 34. So these are the children or adolescents or persons with this with severe IDD level. They require careful supervision and can perform only basic work tasks, and they rarely are able to live independently. They need supervision. Okay, and for profound, around 1 to 2% of people with a diagnosis of intellectual developmental disorder will fall into the category of profound IDD, that is IQ below 20. And as the name itself suggests, you know, uh, here this is like, here you can find severe physical handicaps in children or adolescent persons falling under this category. With training, they may learn to or improve basic skills, but they will need a highly structured environment. And so a lot of physical handicaps, severe levels, that is like, there would be cases where they cannot even sit without support. Okay. And almost speech communication skills would also be almost negligible. So severe physical handicaps are observed in this group. So now, what are the causes of intellectual developmental disorder? And the primary cause, when I was talking about mild developmental intellectual development disorder, I was saying that, psychological and the psychological causes and also biological causes, but more of psychological and sociocultural causes have been observed for mild IDD. But primary causes of moderate, severe, and profound are biological in nature. Okay. And so, although people who function at this level are also affected by their family and social environment, but root cause, the more strongly linked cause are biological in nature. Okay. So the root factors are basically genetic factors are at root cause of moderate, severe, and profound intellectual developmental disorders. Okay. So, and so genetic, under biological causes, genetic would again be a very strong component, and other biological causes could be like, some sort of injury during pregnancy, or some sort of an exposure or an infection in the mother, or malnutrition, or during delivery, if there had been some injury, or immediately after birth the child had been exposed to some toxins, or because of metabolic diseases, the child might have this can lead to a moderate, severe, and profound IDD. So as I said, like, the most important root cause or is genetic. So the most common chromosomal disorder leading to intellectual developmental disorder is Down syndrome. So fewer than one of every 1,000 birth result in Down syndrome, but this rate increases greatly when mother's age is over 35 years. So the higher the mother's age, the greater the chances are that the greater the chances are for Down syndrome. So several types of abnormalities cause Down syndrome, but the most common abnormality is, any idea, in the genes, chromosomes, I'm sorry, of the Down syndrome?
Trisomy 21, ma'am.
Exactly. So there are many causes, but the most many causes, I'm sorry, there are many types of chromosomal abnormalities which cause, but the most common causes, there is trisomy on the 21st chromosome is observed. Okay. And Fragile X syndrome is the second. So the most common, the first most common cause is trisomy of 21st chromosome. And second is Fragile X syndrome is the second most common chromosomal cause of intellectual developmental disorder. Then next is under biological causes, metabolic causes. So metabolic disorders, the sometimes, sometimes children, after they are born, so some of the children will develop, it could be because of genes, hereditary. So they develop metabolic disorders. And what happens in metabolic disorder is their body, the infant's body is unable to break down certain types of proteins. Okay. So the body, you know, see, the metabolic disorders affect so what happens is that, there are certain mechanisms which are involved in what you call this breakdown of protein. So because of, just a second, huh? Just a second, give me a second. There's some problem with the computer. Okay, yeah. So as I was saying, metabolic disorders. So some of the examples of metabolic disorder is, phenylketonuria, Tay-Sachs disease. These are some of the examples. So so what happens is that, for example, in phenylketonuria, uh, the enzyme necessary to break down a type of protein called phenylalanine, uh, the child, the body is not able to produce that. So because of that, there will be a dangerous buildup of this protein. And so when a child is eating these foods, there will be, and that contains this protein, and the body is not able to produce the necessary enzyme to break up this, and to break up this, break down this phenylalanine protein. So there will be a very dangerous buildup of this protein in the body, which can lead to, deficit, in terms of, it affects the intelligence and development of the child's body. Okay, so if it is caught on time, if the doctors are able to identify uh, this condition at proper time, on correct time, so they can, stop this condition from becoming serious, that is the child intelligence or intellectual ability will not get affected. Okay, so if so then what uh, newer medications are also there, which allow some people with phenylketonuria to eat a diet that is or have an unrestricted eat a diet which has this phenylalanine. Otherwise, now if they are able to identify, they will see to it that the babies or children, they follow strict diet that limits intake of this. protein. Okay, so if it is found on time, then the child's intellectual ability will not get affected. But if it's not caught on time, it can lead to severe deficits in intelligence and development also. And another other causes I was saying prenatal and birth related causes. So as a fetus develops, so major health problems in the pregnant mother can threaten the health of the child. Okay, healthy development of the fetus. So if the mother takes food like which has low iodine, if mother is taking inadequate amount of iodine, then that can lead to a condition called cretinism in children, in the children. And alcohol, if the mother is in habit of, like, she is into substance abuse and she is in habit of taking alcohol, then that can lead to a syndrome called fetal alcohol syndrome in the child, which again affects the intelligence and development of the child. And certain maternal infections, also infections during pregnancy, such as rubella, syphilis infection, can cause childhood problems, including intellectual developmental disorder. And another cause is birth complications, such as, like, if a prolonged labor uh, you know, uh, can lead to oxygen, like, not child fetus not getting enough oxygen, and which can damage the brain, the child's brain. Or if there is the umbilical during the prolonged labor or during labor, and if the umbilical cord gets wrapped around the child's neck, then the child's brain will not get enough oxygen. Or during labor, if they have also found, forceps delivery, so vacuum delivery. So sometimes injuries can also take place to the child's brain. So this can lead to all these we can say, uh, during labor delivery, this can lead to intellectual developmental disorders. And then childhood problems. So after birth, particularly up to the age of 6, certain injuries and accidents can also affect intellectual functioning. For example, poisoning, especially lead poisoning. So nowadays, see, previously the paints which we used to paint our house with used to carry lead, and the researchers found that the lead can lead to can have an effect on the intellectual functioning of a child. So nowadays, it is mandatory for all the, for these paint companies or our paints not to contain lead. Okay, so and also other things can happen is, like, before the age of 6. So poisoning or serious head injury, excessive exposure to x-rays also can affect intellectual functioning. Excessive use of certain chemicals, minerals, or drugs, as I said, lead paint can also affect a child's intellectual functioning. Certain infections also during infancy or early childhood, such as meningitis and encephalitis infection, commonly known as brain fever, can lead to intellectual developmental disorder if they are not diagnosed and treated on time. So, what are the interventions which are used for uh, treatment interventions is like residential treatment for especially for severe and profound, even like moderate levels of IDD. So here, like, they can, like, live in small to medium sized community residences. Behavioral treatments are helpful, like they can use operant and classical conditioning techniques to teach them language skills, social skills, and motor skills. So language, social, and motor skills is provided. And under behavioral therapy, method of successive approximation is used to teach basic self-care skills in severe levels of IDD, especially, like, how to hold a spoon. So if they are able to just grip the spoon properly, so you know, see, the ultimate aim is to be able to feed themselves by holding a spoon. So even that goal is split into smaller approximations. Method of successive approximation is if the goal is for the child to eat by himself, even that goal is split into smaller goals, like, to be first able to hold the spoon, be able to, like, fill the spoon. These are like successive sub goals, okay? And toilet training. Uh, this method is used for teaching them toilet training also. So, and cognitive behavioral treatments, cognitive treatments such as problem solving strategies are used to teach them decision making and problem solving skills. Okay, so with this, you have finished your IDD, intellectual developmental disorder. So now we are going to talk about uh, eating disorders. Okay, so eating disorders, it's, as the name itself suggests, it is to do with the core issue is, fear of weight gain. So it has always not been there, but uh, they are talking about Western society, but now to even like the whole world, I would say. Today we equate thinness with health and beauty. So thinness has become not even national obsession, not even international obsession. I think the whole world's obsession. So there has been a rise in eating disorders in the past 3 decades, and the core issue behind these eating disorders is a extreme morbid fear of weight gain. And the diagnosis which are used under eating disorders is anorexia nervosa, bulimia nervosa, and binge eating disorder. Okay, so anorexia nervosa. So main symptoms of anorexia nervosa are a refusal to maintain more than 85% of normal body weight, and the intense fear of becoming overweight, and distorted view of weight and shape. So even when they are getting thin, almost skeleton like, they still see themselves, when they look at themselves in the mirror, they still see like there is a distorted view of themselves. They still think themselves to be fat. They still see themselves as, overweight. Okay, so there is a very distorted view, even when they are been like, when they stand on the weighing machine or asked to, again, look at the numbers, they still will have a very distorted view about their weight and shape. Okay, and amenorrhea means because of this, continuous starvation, restricted diet, restricted food intake, so it leads to stopping of periods in the girls. So anorexia nervosa, what is a DSM-5 checklist? Restricted net intake of nourishment, leading to significantly low body weight, intense fear of gaining weight, even though significantly underweight. Even when they are underweight and significantly underweight, they still fear gaining weight, or persistent behavior that interferes with weight gain. And they have a disturbed body perception, undue influence of weight or shape on self-evaluation, or persistent denial of the seriousness of the current low weight. So even when family members, they start to get worry, they try to make them understand. Even when doctors, physicians are telling them, how the repercussions, the consequences, the negative consequences of such severe weight gain. Weight loss, they will still not understand there will be an extreme denial regarding the seriousness of, you know uh, uh, low weight. So there are two subtypes. Before that, you have to understand, almost 90 to 95% of cases with anorexia nervosa occur in females, and the peak age of onset is between 14 and 18 years. And previously used to be felt as Western phenomena, basically, but nowadays, though, as I just mentioned, the whole world is, so between zero point 0.5 and 3.5 females or in Western countries develop the disorder. I think almost the whole world. So it is increasing. The rates of anorexia nervosa are increasing all over the world, be it Eastern countries, Europe, whichever country you want to talk about. So there are two main subtypes under anorexia nervosa, uh, the restricting type and binge eating slash purging type. So under restricting type, uh, there will be, they will lose weight by cutting out sweets and fattening snacks and eventually eliminating nearly all food. So they will start off with, like, not eating fattening foods, fattening snacks, sweets, and then slowly, steadily, they will start to eliminate almost every type of food, nearly all food from their diet, and show almost no variability in diet. That is like, see, all of us at some point in our life have, had gone on diets, and they we can't, and we vary our diet. Some days, like, sometime in our life we'll try this type, then somebody else talks about other thing. So here that variability is not seen. Okay, so they, for them, it's like they will eliminate, they will cut off almost nearly all food. And binge eating purging type, here they will lose weight by forcing themselves to vomit after meals. So they will eat something. So under restricting type, it's like completely they will come down to like not eating any food. So that is what they do. Here binge eating and purging type is they will eat food, and then after eating they will force themselves to vomit, or they will use laxatives or diuretics. So that, they're purging whatever they have eaten out of their body. So like, so it's almost similar with bulimia nervosa. Uh, People with this subtype may engage in eating binges. So under bulimia nervosa, we have a type called binge eating. So here under binging, that subtype of anorexia nervosa, binge eating purging type, they will binge, like, they will binge on food, and then they will lose weight, or or by vomiting, they'll purge whatever they have eaten by either vomiting or using laxatives or diuretics. So what is a typical case like in anorexia nervosa? So here, how it starts off here is a normal to slightly overweight female will, typically, like, go on a diet. Okay, because she feels that she is slightly overweight, or normal to slightly overweight female will go on a diet. Then this diet starts to escalate. There will be an escalation towards anorexia nervosa following some sort of a stressful event in her life. It could be that, separation of parents, or they moving away from home, moving away from, like, if there has been a transfer, because of some reason, the child has to shift schools, move away from home. So some children would find it to be very traumatic, okay, and lonely. So, or experience some sort of personal failure. So because of these stressful events, so a female or an adolescent who's been on a diet, maybe he, a normal weight, she might be having a normal weight or slightly overweight. Because of this stressful event, it will escalate towards anorexia nervosa. So most patients recover. However, about 2 to 6% become seriously ill and die as a result of medical complications because of this severe weight loss and severe starvation which they do, or by suicide. So the key goal for people with anorexia nervosa is becoming thin. That is what they want to be. They want to be thin. And what is the motivation behind becoming thin is fear. What is this fear? Fear of becoming obese, fear of becoming fat, fear of giving into desire to eat, fear of losing control of their body size and shape. Okay, so there, this fear is the driving motivation, uh, uh, you know, for this condition. So despite their dietary restrictions, people with anorexia nervosa are preoccupied with, it's almost like, contradiction, preoccupied with food. So they keep thinking about food, reading about food, planning for meals, but they will starve. There will be like food deprivation, food starvation is what they do. And people with anorexia nervosa think in distorted ways. So they usually have a very low opinion of their body shape. They tend to, as I told you, they tend to overestimate their actual proportions. So even when they are like skin and bones, even when they are like almost down to this, almost like a skeleton, when they look themselves in the mirror, they still see that, themselves as overweight or as fat. So they tend to overestimate their actual proportions, and they have these maladaptive, they hold maladaptive attitudes and misperceptions, such as like, I must be perfect in every way. I will be a better person if I deprive myself. Deprive in sense, not eat, depriving food. I can avoid guilt by not eating. So they have these maladaptive attitudes. And people with anorexia nervosa also display certain psychological problems also. So they will, usually they will suffer from depression, usually mild level of depression. They'll suffer from anxiety, low self-esteem, insomnia, or other type of sleep disturbances, substance abuse, obsessive compulsive patterns, and perfectionism. So these are some of the psychological problems which are observed in people with anorexia nervosa. And they also suffer not only these psychological problems, they also suffer from medical problems also. And these medical problems are caused because of starvation. So what are the medical problems? The first and foremost is amenorrhea, that is, stopping of periods, low body temperature, because there is nothing in their body, no fat, nothing. So see, the fats in our body provide us with heat, isn't it? So low body temperature, low blood pressure, body swelling, reduced bone density, slow heart rate, metabolic and electrolyte imbalances, dry skin, brittle nails, poor blood circulation. So these are some of the medical conditions observed in people with anorexia nervosa, which are caused by starvation. Now, the next disorder, bulimia nervosa. So, bulimia nervosa, also known as binge binge purge syndrome, okay, is characterized by binges. Binges means, what are binges? Binges are bouts of uncontrolled overeating during a limited period of time. So here they are indulging in uncontrolled overeating during a limited or short period of during a limited period of time. So what is the typical case? So here what happens is, again, a normal or slightly overweight female has been on a intense diet. And then research suggests that even among normal participants, binging often occurs. See, all of us, like, as I told you once, maybe once we all of us have tried once or one time or the other dieting, isn't it? So when we were dieting, we would, like, when the moment we come off diet, we will indulge in binging. We will go over the top. Okay. So even among normal participants, normal individuals, binging occurs after strict dieting. So, like anorexia nervosa, about 90 to 95% of bulimia cases occur in females, and the peak age of onset is between 15 and 21 years. And symptoms may last for several years with periodic period of let up. Like, there can be a period where the symptoms are not observed, but okay. So, disorder is characterized by inappropriate compensatory behaviors, such as, like, in compensatory behavior means, like, they will go on binge eating, and after binge eating, they will either force themselves to vomit, or they will misuse laxatives, diuretics, or anemias. So this is, they're compensating for their by using these behaviors, or by forcing themselves to vomit. They are, like, compensating for their binging. Okay. So there are subtypes again for bulimia nervosa. Purging type bulimia nervosa. Here they will, there is forced vomiting, misuse of laxatives, diuretics, or anemias. And then there is another subtype is non-purging type of bulimia nervosa. Here what they will do is, their compensatory behavior is they will go on fasting, or they will exercise frantically, extreme levels of exercises to burn whatever they have eaten. Okay, so this is and so here DSM-5 checklist is for bulimia is recurrent episodes of binge eating, and these episodes are followed by compensatory behavior in order to prevent weight gain. Okay, and the compensatory behaviors could be for vomiting, using laxatives, anemias, diuretics, fasting, exercising frantically, and these symptoms continue on an average at least once a week for should so that is the duration, at least once a week for 3 months to give this diagnosis. And undue influence of weight or shape on self-evaluation. So extreme importance is given to body shape or their weight. So patients are usually generally of normal weight, but they often experience fluctuations. Some may also qualify, some patients of bulimia may also qualify for a diagnosis of anorexia. And people with bulimia nervosa may have between 1 and 30 episodes per week. Binges are often carried out in secret. Okay, family members or friends, they, people around them will not be aware of this. And binges are usually preceded by feelings of, so they will binges are before binge eating or going on these like episodes of binges, they are followed up by feelings of tension or powerlessness. So basically they'll be experiencing extreme negative emotions, and to make themselves feel good. So although I mean not exactly make this feel good, so they, you know before binging they'll be experiencing under a lot of stress or powerlessness. So binge itself, when they eat, so the binge eating will make it's pleasurable to them. So it is usually, and then after binge eating it is followed by feelings of self blame, guilt, depression, and then they will indulge in purging that, or no, basically compensatory behaviors. And then we have binge eating disorder, the third. So binge eating disorder is repeated eating binges during which they feel no control over their eating. These individuals do not perform inappropriate compensatory behavior. So that is the difference between bulimia nervosa and binge eating. So binge eating, they will eat, there will be repeated binges during which they feel no control over their eating, but they do not perform inappropriate compensatory behavior. As a result of their frequent binges, around two-thirds of people with binge eating disorder become overweight or even obese. So, what is the DSM-5 checklist? Recurrent episodes of binge eating, and binge eating episodes are associated with at least three or more of the following. That is, unusually rapid eating, eating large amounts without physical hunger, eating until uncomfortably full, eating alone because of embarrassment, feelings of self-disgust, depression, or severe guilt after episodes of binge eating, and significant distress. Uh, they'll experience significant distress regarding binge eating, and binge eating occurs on an average at least once a week for 3 months, and no pattern of inappropriate compensatory behavior. That is, they will not indulge in vomiting or using laxatives. So there is no purging behavior here. So what are the causes? So many theorists and researchers, they believe that there is a multidimensional risk perspective. So several factors place individuals at risk. So the more the number of risk factors, the greater likelihood that the person will develop this eating disorder. So what are the leading factors, risk factors? Is under psychological uh, problems with ego, mood disturbance, and and then we have biological risk factors and socio-cultural risk factors such as society, family, and so what are the psychological risk factors or basically the causes? So according to a theorist called Brush, he basically developed a largely a psychodynamic theory of eating disorders. And according to him, he says that eating disorders are a result of disturbed mother-child interaction and which leads to serious ego deficiencies in the child and to severe perception disturbances. And he argues that parents may respond to their children either effectively or ineffectively. Effective parents will accurately attend to a child's biological and emotional needs. Ineffective parents will fail to attend to a child's emotional needs and biological needs. So they feel, so what happens, when a child is emotionally disturbed or the child is feeling anxious or is emotionally disturbed, they will feed the child when the child is anxious rather than comforting the child when he or she is emotionally disturbed. They will feed the child. Okay. So, and when the child is tired, they will comfort it. So, children will grow up to be confused. Okay. So, according to them, like, whenever they are feeling emotionally disturbed or anxious or sad, because that is what they learned in childhood, they will eat. Okay. So, so that is how these eating disorders will develop. So, and another cause is mood disorders. Mood disorders themselves can trigger eating disorders. So many people with eating disorders, particularly with bulimia nervosa, they experience symptoms of depression. So the researchers, they believe that mood disorder, they set the stage for eating disorders. And there is a lot of there is a lot of research support, empirical support towards this theory that mood disorders can trigger or set the stage for eating disorders. Okay. And they've also found that close relatives of those with eating disorders uh, have higher rates of mood disorders. So if there is a family member with mood disorders, possible that the child or somebody related to that family member might develop eating disorders. And they have found that people with eating disorders, they have abnormal levels of a neurotransmitter called serotonin. So there are abnormalities in serotonin observed in people with eating disorders. So symptoms of eating disorders. Uh, so treatment for eating disorders. So sometimes or many times psychiatrists, they prescribe antidepressant medications for treating persons with eating disorders. And another biological factor is like there are these theories, researchers suspect that certain genes may be responsible for eating disorders. So the more closer you are to a family member with eating disorder, the higher chances that you would also inherit that. And structural abnormalities in brain, such as especially in the hypothalamus, have been linked with eating disorders. And the most important cause is society pressure. So now that we have the standard of female attractiveness, because of these standards of what is supposed to be attractive, especially the magazines, these beauty contests, this Miss World, Miss Universe, and the magazines, the movies. So that is placing all these things are researchers have found to be responsible for emergence of eating disorders. And they've also found certain subcultures or certain groups at greater risk. Those groups are like, people who are models, actors, dancers, and certain athletes are at greater risk for developing these eating disorders. And the society under this sociocultural factors like Researchers have found that women of higher socioeconomic status are more concerned with dieting and thinness. So these women have higher rates of eating disorders than women belonging to middle or lower socioeconomic status. So, and then family environment is also responsible. So if mother is continuously worried, oh, you're sitting on the dining table and then children are also eating along with you, and then adult is talking about like I should go on diet, I am becoming overweight. So that is, the children will model that behavior, and there will be like this a negative type of message is going to children that to be attractive you have to be underweight. I mean, you have being fat, overweight is not attractive. So even the family environment plays a very critical role in the development of eating disorders. So how are they treated? So there are basically treatments have two important goals: the correcting dangerous eating pattern and addressing psychological and environmental factors. So especially like family therapy, psychological therapy, and even immediately would be medical management, because they children with or adolescents with eating disorders, like they starve themselves, so that can lead to a lot of medical problems. So combination of like medical treatment, psychiatric treatment, and psychological treatment is used. A combination of treatments are used for eating disorders. And then now let's fastly go to substance abuse. We're just left with 10 minutes.
Ma'am, excuse me, I got a question.
I don't have time. Let me finish substance abuse. If I have 1 minute, then I'll talk to you.
Just I wanted to know about the chapter number of these eating disorders.
Hmm?
From which chapter this topic
Adolescence
was?
disorders,
Pardon?
adolescence.
Okay, thank you.
Okay, so substance
Okay, ma'am,
abuse.
thank you.
Yeah, yeah. Now, substance abuse. So, when we are talking about substance abuse or all, okay, so regardless of what people may experience as positive effects of drugs and alcohol, so when we talk about substance, we are talking about drugs and alcohol. Okay, so they both, be drugs or alcohol, they both have negative effects on our health and ability to function, especially when used repeatedly. And this recurrent use, this repeated use, will result in substance use disorder. So there are two substance use disorders: abuse and dependence. Okay. So substance abuse is defined entirely on the criteria of impairment. That is, if someone's repeated use of a substance causes impairment in even one area of his life, it could be like his loss of a job, financial losses, family losses, society losses. So even in one area, then you can say the person can be described as a substance abuser. Okay. And when you talk about dependence, so there are two things which you have to understand before we talk about dependence. So when a person is taking substance, certain conditions get created. One is tolerance. Tolerance is there will be a need for increased amounts of substance in order to achieve the desired effect, or a diminished effect with same amount that used to produce the desired effect. So tolerance means, see, the body will start to develop tolerance towards whichever substance the person is using. For example, like whatever desired effect, like the person might start with one peg, and in whatever desired effect, maybe he might be thinking he feels happy, relaxed, more sociable. So whatever desired effect he got from that one peg, and so slowly steadily he will have to increase the amount of that the alcohol to get the same level of desired effect which he initially got from that one peg. Okay, so the body starts to develop tolerance. So to get that same effect, you might need to take increased level. So it could be like you will go up to one bottle also to produce that same desired effect. And the second condition or phenomena associated with substance abuse, I mean, basically dependence is withdrawal. So the body, see, so when a person is repeatedly taking alcohol or substances or drugs, so the one is tolerance, body starts, there will be tolerance. Second is dependence. Dependence is the body starts to become dependent upon that alcohol, I mean, that substance. Okay. So if suddenly the substance or that drug or that alcohol is stopped, then the body reacts very adversely. So the person, will start to experience physical symptoms, very painful physical symptoms and psychological symptoms, if and these if suddenly that substance is stopped, because the body starts to become dependent upon that substance. Okay. And these reactions, these physical or psychological symptoms, these adverse reaction by the body, and sometimes these are called as withdrawal symptoms. And sometimes these withdrawal symptoms can be so severe, and they have, it can lead to death also. That is why when a person is like, the immediate, when we're talking about treatment for de-addiction treatment, we're talking about, so there is a detoxification treatment, and it should be done under the medical supervision, uh, because of these withdrawal symptoms. So they are monitored so that the person is like, does the condition doesn't become serious or doesn't lead to death. Okay. And that is why people are not easily able to stop substance abuse, because of these withdrawal symptoms. The withdrawal symptoms themselves are so painful, the person fears uh, uh, s- these withdrawal symptoms. That is why we can say, like, one of the aspects which doesn't allow a person to stop using substances. So substance abuse and dependence can be chronic, progressive, degenerative problems with severe negative outcomes, but the course can they take vary depending upon what is being used, which type of drug, alcohol is being used. That decides the course of the addiction. Substance use disorders can begin at any age and becoming nowadays currently more prevalent, especially among adolescents. People with use disorder show remission, especially late in life, but relapse is very, very frequent. And as I told you, very common in adolescents. So causes of substance abuse, genetic and biological cause factors are one of the causes. So most research into substance abuse involves alcohol, as alcohol is legal and very widely available. So evidence of genetic transmission comes primarily from alcoholism research. And research shows that there is strong role of hereditary, especially among men, when it comes to substance abuse, especially alcohol abuse. And psychological factors, numerous psychological, psychosocial factors have been implicated in the onset and course of substance abuse. And reinforcement also plays a role. So, what reward the person is getting when he or she uses alcohol or any substance. And that is like, there is a hypothesis called tension reduction hypothesis. So people have this notion who are into alcohol abuse. They feel that, they have this notion that when they use these substances, it reduces their tension levels. Okay. And it helps them to relax. So this is because of this notion they indulge in these substances. And another theory is abstinence violation effect. This theory explains why people relapse. So what happens is that, a person who stopped taking alcohol or drug, suddenly, there will be a minor violation, that, because, friends might insist, or he might go, or she might go to a function, or for some reason there will be a minor violation, that he might have taken a sip after months of not taking any alcohol, nothing. He or she might take one sip or one peg, and then starts to think like, now I've already violated my you know uh, you know abstinence, like, so now let me go, I fully violate, and then they will go on a binge. Okay. So one forbidden drink will lead to more. And there is a theory called addictive personality has also been suggested, but it is a very controversial topic. And so far, there is no evidence, but research indicates that some aspects of a person's personality can also contribute to alcohol or substance abuse. And environmental factors are also responsible uh, such as, like, a particular culture, particular society, particular type of family in which we live. Sometimes, like, that culture itself condones alcohol use, and that's why individuals will start drinking or abusing drugs. And now, what are the treatment? So many approaches are used, and as I told you, the first and foremost is, biological treatment. So biological treatment will involve detoxification, and it can be done in as an outpatient or inpatient treatment. So systematically and medically, it supervised withdrawal from drug is done. And there are two strategies used here, like gradual withdrawal by tapering the substances in slow dose. I mean, lesser doses, or it could be like, immediate, complete stopping of the alcohol or drug the person is taking. Okay. So, and to take care of withdrawal symptoms, they might be given some additional medications to block these withdrawal symptoms. And detoxification programs also seem to help motivated people, be able to manage from withdrawal symptoms. And along with detoxification, I'm sorry, when they are in inpatient or outpatient setup, when they're going for detoxification, uh, a combination of medical treatment and psychotherapy has been found to be very helpful. And so, what are the therapies? So, psychodynamic therapies, they, what under psychodynamic therapy, they first guide clients to uncover. Yeah, hello.